Yeah. Okay. I'll wait 5 minutes.
Yeah, it just says notification. Did it pop up? where you have the top of say early in your health system.
Yeah. Okay. Did you get it? Nice. Yeah.
Guys, we're going to get started a little early so we can get you guys out of here as quickly as possible. Okay. So I think I met all of you guys on Critical Care Day. I'm Radhika Shah. I'm one of the Associate Program Directors and in Pulmonary and Critical Care. I also co-chair the Clinical Competency Committee, and so we wanted to give you guys a little bit of information on what this is and what we sort of look at for this, just so you have some familiarity of why we do it and what the history behind it is. It shouldn't affect your day-to-day life too much, though. All right, so I'm going to go over a little bit about the medical education background of the CCC, review the timeline of the CCC, which is probably the most relevant part for you guys. We're going to tell you a little bit about who's on the Clinical Competency Committee, and then review some possible outcomes from our meetings when we review everybody. So I wanted to use this opportunity to go over some of the ways that we give feedback to you guys in this residency program, because sometimes you can get kind of lost in the grind of rotations and things like that, and you may be like, oh, well, I don't know, like I don't get any feedback on my performance and stuff like that. And so I wanted to go over like what places you do get feedback and opportunities for you to ask for feedback, you know, because everybody gets really busy, but most people are willing to give you feedback if you ask. So there's formative feedback and summative feedback. Formative feedback is the kind of feedback that allows you to improve on the fly on your performance and things like that. And then summative is more of a kind of like an evaluation of your performance or your knowledge over a certain period of time. So our types of formative feedback example includes mentorship meetings, verbal feedback that you might get on rotations by attendings or by your peers or senior residents, and then written feedback, which you'll get on new innovations, and you'll be able to see some of the feedback that you get from your peers and from your attendings. And then summative feedback examples include board exams, in-training exams, and the semi-annual evaluation, and that's sort of where the CCC comes in. So in our specific program, these are some of the types of feedback that you'll get and forms of feedback that you'll get. So verbal feedback is available at any time when you're rotating with everybody, either from your senior resident, from your peers, or from your attending. And so you should be getting that after every rotation, but if you want feedback more frequently, to actually ask, and people are always willing to give you some sort of feedback in that capacity. End of the rotation, you will get written feedback from attendings as well, and then we do send forms to like your co-residents. We also have 360-degree evaluations, like in terms of like the nurses in the clinic. We've been trying to get nurses on the floors too. I don't know how successful it's been the last year, but something we're working towards. But those are the type of evaluations that you, feedback mechanisms that you get in terms of end of rotation. And then we have mentorship meetings, which I know Dr. Davis had done a presentation on the mentorship program earlier today. It's used to, those mentorship meetings are used for, you know, your career planning and how you're adjusting to residency and stuff like that, but we also use it as another vehicle for giving you guys feedback, because it's somebody who's kind of dedicated to kind of knowing your portfolio and being able to give you feedback in a little bit more of a bird's eye view of your performance during the residency program. And then the semi-annual evaluation is what you get every 6 months, and that is reviewed with you with the program director, with Dr. Carey. And so when you get your semi-annual evaluation, the recommendation on what type of feedback you're going to get from that semi-annual evaluation comes from the Clinical Competency Committee. So that's a committee that is made up of multiple attendings from different specialties that are involved in your residency education, and they go over a bunch of data regarding your performance, which I'll go over in a second, and give recommendations on specific action plans on what you can do to improve as you move along in your residency program and whether you're on track for promotion, okay? So at Erlanger, you know, we used to, just so you kind of have an idea, I'll go through this fast, but basically we used to do these meetings where we only focused on residents who were struggling and use that for the majority of the time that we did our conversations. And a lot of times it would be, you know, rumors on how residents are doing and stuff like that. And so we've kind of tried to shift over to a model called the Developmental Model, which is where we go through each and every resident in a systematic way with the same data that we review any resident for, and then come up with recommendations. So even if so no matter what your performance is, if you're a high-performing or average-performing resident, we'll still give you feedback to try to get you even better than what you are. So we're hoping to get better at that as we continue to make the committee stronger. So that's our goal. Okay, so we still go over residents who maybe need a little bit more attention, but ideally we try to do a combination of both models. Okay, so the timeline for our feedback mechanisms during the year. So as Dr. Davis probably mentioned, you know, mentorship meetings will happen before the fall, okay? And that's sort of your first tier of feedback outside of your rotations, okay? We'll usually get the data from the mentorship meetings and then all of your evaluations, and we'll have a clinical competency committee meeting in November, so that you can have your semi-annual meeting with the program director in December. And then that process repeats in the spring. So you'll have a mentorship meeting in the spring, February, March, April, that range. We'll have a clinical competency committee meeting in May, and then in June we have, you'll get, Dr. Carey will get the recommendations from the committee, and then you get another meeting with him regarding your performance and things like that. So that's sort of the timeline we try to stick to for the Clinical Competency Committee. So what do you have to do with all this stuff? It sounds like a lot of work for us, but what about for you guys? So it's really important in all of these feedback mechanisms that we have a lot of data on your performance, because we don't want to be giving you recommendations on how to improve if we don't know what's going on your rotations and things like that. So make sure that, you know, when you get the meeting reminders for your mentor, or you may have a mentor that maybe needs just a little bit more of a push to get a meeting scheduled, make sure you're proactive in scheduling your mentor meetings so that you can go over, like, what do I need to improve on, what am I doing well, things like that. You're going to have a lot of peer evaluations to fill out too. Make sure that you fill them out, because your peers deserve the feedback that you guys deserve as well. We do look at attendance for conferences, so make sure that you're attending the required amount of conferences. We have specific board review prep requirements, and so making sure you're keeping up with that, and then keeping your meeting with the semi-annual meeting with the program director. Okay, so just so you guys know, some of these names won't seem very familiar to you, but basically all of these people are from different specialties. We have nephrology, outpatient, primary care, infectious disease psychiatry, and cardiology. So it's pretty well represented, the people that are on the committee, to sort of help sort out the data that we have for you guys. So this committee gets together twice a year, and we review these items for every resident. So ITE scores, their milestone evaluations, their comments on their evaluations, conference attendance, any other evaluations like from nursing and things like that. Pharmacy, I think, does evaluations too. And then your journaling as well. And then scholarly activities we may look at as well, especially if you're trying to apply for a fellowship. We may look at that a little bit more in detail as well. So the possible outcomes from CCC are, in the winter when we review you guys, we'll either say that you're on track for promotion, and this is the majority of residents, okay? And then, or you're not on track for promotion. And when that happens, if there's a concern for a resident's performance, they'll get a performance improvement plan, which is like a very detailed plan on how to improve, and they get reevaluated either in 3 or 6 months. And then there's a spring meeting that occurs where we actually decide whether you'll be promoted or not to PGY2, okay? So, and there is an option of getting promoted with a performance improvement plan as well. So it's sort of like an internal probation kind of situation. Now, at any time, depending on if there's some big, huge professionalism issue or really, really big academic issue, there's a possibility for termination, but I just wanted to remind you guys that our ultimate goal is to graduate you guys. So I just wanted to just put that out there, that there is a possibility, but it's very, very rare. Okay. So once we have the clinical competency committee and we decide whether or not people are ready for promotion, we also go over, okay, so this resident needs to maybe has a lower ITE score than we would like and needs to really focus on studying, or this resident should really have more procedures than they do right now at their level of training, and so we'll tell them try to be more proactive about getting procedures, et cetera. And then we give those recommendations to the program director, and then he'll review it with you guys at the semi-annual evaluation. Okay, so that's sort of the steps to how that all comes about. Okay. So just a couple things that I wanted you to get out of this is that there are lots of forms of feedback in our program, even though it may not look like it at first, and so try to take advantage of all of that, because there's a lot of people involved in your residency education. I wanted you to know what the Clinical Competency Committee, what the function of it is and what your responsibility is, and that's to help gather data about your performance, because that only helps you in the end, having more data. And that we, ultimately we want everyone to graduate. There's no, we're out to get you. And so the whole point of the committee is to make you guys better. So, okay? Any questions about that? All right, cool. So I think Dr. Carey was going to do his wrap up now, and then I'm going to give you guys a tour of the Sim Center, and then we'll let you guys go, okay?